Can you all hear me? Perfect. So, as Crystal said, I'm the other intern at Birdwatch, and your last presentation of the evening. Not sure if that's the stage best for last, or hoping you guys won't go home before I start. We'll pull everybody later. So, as Crystal said, I was born and raised in Ontario. Don't hold that against me, sorry. And I've been riding cutting horses, and I have shown sheep during my school time. But back to the topic at hand, laminitis. So how many of you people in the audience have seen a case of laminitis? That's what I thought. So what kind of signs were you guys noticing in those horses? You're going to be talking a lot, so.
Pointing.
Yeah? Anything else? There were more hands than this one. There we go. So, often presenting complaints are lameness. We often notice it's worse when they're turning, or that classic sawhorse stance that we see up on the screen, sometimes hesitation to walk, and in some severe cases, the horse is actually done not willing to rise when their feet are so painful. So we encourage seeking veterinary care to ensure the best prognosis for your horse. So when we come out to see your horse, we're going to do a basic physical exam, but also look at a few things more closely. So looking for elevated digital pulses, are their feet warm, any pain on hoof testers, any hoof wall abnormalities like the photo, are they overweight, are they underweight, and ask you guys questions about their shedding out history and any weird coat abnormalities. But before we can really dive into what laminitis is, we should talk about what's going on in that hoof. So we all know what the hoof looks like, so we see our hoof wall, but within that hoof wall, we have the coffin bone. And the coffin bone is suspended in that hoof wall by connective tissue called lamellae. And so these lamellae, as you can see in the top photo, are what we call interdigitated to increase the surface area. And because of this increase in surface area, we have a really strong bond created, and that counteracts the forces of gravity from the weight of that horse, as well as the deep digital flexor tendon, which is that blue line along the back that's trying to pull that coffin bone back. So this is a super strong bond. The problem arises is when we have triggers that cause inflammation in those lamellae, and that bond gets weakened, and then our forces of gravity and the deep digital flexor tendon start to wane. So in that x-ray, you can see on the right a somewhat normal x-ray, and then the one on the left, that coffin bone has sunk and has begun to rotate because that DDF tendon and gravity are winning this battle. Oh, I'm sorry. I'm looking at it. This is why I'm sad. So some of the causes here. The first three we're going to go over in more detail, but just to highlight the last two, there are some toxic causes of laminitis, like bending your horse on black walnut shavings will induce a bout of laminitis. And as I was telling people during the break, use of corticosteroids in joint injections or to treat things like asthma does carry a small risk of laminitis as well. It's a small risk in the average horse, but still present, and horses with endocrine diseases has a little bit of an elevated risk in those guys. It's often a warning we'll mention when we prescribe steroids. But going through our causes, so firstly we have support limb laminitis. And this is something we see with severe fractures or severe joint infections, and that horse is forced to bear more weight on their healthy limb, and that extra bearing weight will induce some laminitis in that healthy foot. And these are often, the problem with these ones is that because they have a fracture or something in that affected limb, their unaffected limb doesn't show limbs until the laminitis is actually worse than the fracture. And that's quite end stage, and some horses are actually euthanized because of the laminitis rather than the primary problem. So this is a significant concern for these severe orthopedic cases. Next up, we have our endocrine-related disease. Yeah. Sorry, endocrine diseases, and these are our most common type of laminitis that we see. So the first endocrine disease is pituitary pars intermediate dysfunction, or PPID. Anyone know the common name for that? There we go, perfect. See, we're talking. And the other one is equine metabolic syndrome, and often these two things kind of go hand in hand. So first up, we have PPID, and I'm sure a lot of you are familiar with these common signs. So poor hair coat, delayed shedding, laminitis, muscle loss, weight loss, lethargy, and recurring infections. And so all breeds are susceptible, but there is a predisposition to ponies and Morgan horses. And we usually see an average onset later in life, so one paper said 19 years, so late teens, but it has been reported to be as young as 7 years old. So what is PPID? In short, it's a small little tumor in the pars intermediata portion of the pituitary gland, leading to a high level of ACTH in their bloodstream, and that's what's responsible for these clinical signs that we see. It is important to note, though, that not all PPID horses will develop laminitis. It develops about 30%. And these 30% of horses often have high levels of insulin, which is indicative of insulin resistance. So, what we do is we test these horses their ACTH, and we often recommend insulin testing at the same time to see if they are in a higher risk category. And to treat that PPID, we can put them on a drug called Preventative. Next up is metabolic syndrome. There's a lot of fat horses. It was not hard to find these horses. None of them are on Facebook, don't worry. So there's 3 criteria for acute metabolic syndrome. So first is generalized obesity or fatty deposits. We usually see them on the crest of the neck or on the tail head. And second of all, insulin resistance, sensing it being here, right? And then lastly, laminitis. So those are the 3 criteria. And oftentimes metabolic horses have had a bout of laminitis that maybe was undiagnosed or was subtle, and later when we go to truly diagnose it for a more severe bout of laminitis, we see radiographic evidence of that previous bout of laminitis. And again, we have our susceptible breeds. The list is a bit longer. So we have our pony breeds, our Morgans, our Tennessee Walkers, our Saddlebreds, Spanish Mustangs, other Spanish breeds, and warm bloods. But truthfully, all fat horses are susceptible to this. So again, we're going to recommend that insulin testing, and oftentimes we recommend testing for Cushing's as well, just to make sure we cover our bases. And then management of these horses is really aimed at reducing dietary sugar through soaking their hay or finding low sugar hay, cutting their grain, no pasture access, and increasing their exercise with the end goal of losing weight. And if your horse is struggling with that, there are some medications that in certain circumstances we can use, such as levothyroxine, that can aid in that weight loss. And lastly, one of the most severe forms of laminitis is due to sepsis or SIRS, which is a long acronym that is not important for you guys, but essentially it's like a large inflammatory cascade that's typically triggered by an infectious cause. So things such as retained placenta, grain overload with eating too much grain, severe colics with dead gut in their abdomen, colitis cases or pneumonia are often the triggers, and this severe cascade just targets the laminate. Interestingly, in people, when they have sepsis, we usually see things such as heart failure, liver failure, kidneys are affected, but in horses it's their feet. They're a really great design, guys. So treatment is removing the inciting cause, so maybe it's going to surgery and cutting that dead bowel out, or putting that horse on antibiotics for their infection, and then preventive measures. So there's a bad advice there, because anybody that works at Burwash knows that they go on ice as soon as we worry about laminitis from sepsis. Sarah and I have spent many nights doing these ice boots. And so we start early, because once there is evidence of laminitis, the ice boots aren't as effective as if you get it ahead of time. So those are our common causes. So how are we truly going to diagnose this? So diagnosis can be as big or as little as we can do. So history and clinical signs can often point us in that direction. But we can confirm that with radiographs. So on the top image, I got that right? The top one, we see that radiograph, and that problem bone has sunk and it's not in that normal position. And then sort of the next stage would be to do a venogram, which is where we inject contrast into those blood vessels to see the blood flow around that coffin bone. And as you can see on the lower picture, their blood flow is interrupted down the front of that coffin bone. And sometimes horses that are limited have no movement of that coffin bone, but we do see changes in the blood flow. So those sort of are steps we can do. And then lastly, treatment. Treatment's targeted again at that inciting cause, treating that Cushing's disease, getting that infection under control and then keeping them comfortable. And then, depending on the severity and the timeline, talk to your veterinarian and farrier about therapeutic sharing if that's indicated for your horse. So that is all.